The major driver mutation in the vast majority of patients with pancreatic ductal adenocarcinoma is the mutated KRAS gene, which for the time being remains undruggable, although lots of research attention is being paid to it. What might be more actionable right now is that just under 1 in 5 patients with this disease will have some kind of mutation in the DNA repair pathway, particularly related to homologous repair. So this study was presented by Dr. Michael Pishvayan out of the Lombardi Cancer Center, who led a large group of investigators, and they looked at the Know Your Tumor database, cancer of the pancreas, several hundred patients, about half of whom were resected and half of whom had advanced disease. And they asked the question whether firstly, how many of these patients had defects in DNA repair, and if so, what was their fate with respect to whether they were exposed to platinum treatment or not. What they found was that those who were resected did not have any different outcomes with respect to prior platinum that was statistically significant. But those who were not exposed to prior platinum actually did numerically worse, although it was statistically not significant. Those who were exposed to prior platinum did in fact numerically better, but that was also statistically not significant. However, those with advanced disease who were platinum naive actually did numerically worse than those who had proficient DNA repair, although that wasn't significant. The major finding actually is that those with advanced disease who were exposed to prior platinum and did have a DNA repair defect, particularly in genes such as BRCA1, BRCA2, and PALB2, had a major survival advantage compared to those who were proficient, with a very high statistical significance. Most of our patients have advanced disease. I think only about 20% of them are resectable, and maybe not all of those get to surgery. So I think this finding has major implications for those with advanced disease, which is most of our practice. The NCCN and other guideline organizations are now tilting towards recommending germline testing for these genes in all patients with carcinoma of the pancreas. If that were to be done, we would pick up a DNA repair defect in about 16–17% of these patients. And there's a sense now that this is a fact that should guide treatment, and that platinum-based treatment should be prioritized in these patients, and they should possibly not get exposed to gem nab-paclitaxel, at least in the first line. The other strong possibility is that these patients may benefit from PARP inhibition, and although this is not a recommended treatment at this point, it is an intense focus of research. There are several trials that are ongoing that are investigating the activity of PARP inhibitors, both as single agents or in combination with chemotherapy. And we have a limited data set so far that indicates that even single agent PARP inhibition can result in occasional complete responses and some partial responses, at least in a significant minority of these patients who have DNA repair defects.